Right, hello and welcome to today's webcast. It's Friday the 31st of October, so Halloween. No questions today, so what I wanted to talk about is a few basics about rabbit care. And this is something where we see a lot of problems coming from really it's lack of knowledge and I guess lack of understanding of rabbits. Now, the biggest thing that we see causing problems with rabbits really is diet. And I think what we get with rabbits is we get this almost belief that we have to be giving them a really good quality food, and that's actually one of the worst things we can actually do. When I talk about good quality food, the really expensive sort of stuff, the stuff that's full of grains and kind of oats and all things that are tasty for rabbits. Now, the problems we get with that, rabbits really have evolved to survive on very, very poor quality food, and there's a couple of things that kind of happens if we give them really high quality food, or kind of high energy food is probably more of a way to put it, with high energy, low fiber food. So with high energy food, number one thing we get obviously is obesity. Just the same as people eat high energy foods constantly, you're going to get overweight. Now with rabbits, that can start to cause problems, particularly around the back end. Now rabbits, their gastrointestinal system works slightly different to your normal sort of animal, in that they produce two types of feces effectively. So there's what basically happens when a rabbit eats, they eat the food, passes through their gut, gets fermented in the back part of the gut, and then they pass a little pellet which the rabbit then eats, and that's where they actually get their energy from. So basically when you feed a rabbit, you're pretty much feeding the bacteria in the back part of the gut, and then the rabbit eats the bacteria. So it does a couple of cycles through them. Now with high energy food, you can get upsets in the bacteria, but more than anything, you really just get that obesity, and that can actually affect their ability to reach around and eat those pellets to get them going back through the system. So that can lead to some nutritional deficiencies, but also not being able to keep the back end clean really leaves them prone to fly strike and other problems like that, and mucky back ends. And fly strike is a really big issue in rabbits and something you've got to be very, very careful of. So keeping their weight in that ideal weight range really helps protect against it. Now, the other thing we can get with high energy food is we can get gut upsets, and rabbits' intestines are very, very fussy parts of their body, and so any sort of diarrhea or any sort of food problems can lead to either ileus or gas or diarrhea, and that can be quite rapidly fatal in rabbits. So really important to get that diet right. Now, the other place where we see diet causing problems is in the mouth. Now, rabbits' teeth constantly grow through their life, and they've evolved to eat really rough, rubbish food. So kind of your grass really is what a rabbit has evolved to eat, and that's what they should be eating. And what happens if they eat these high energy foods is they don't actually chew enough, and so that whole process of chewing is designed to wear their teeth down so that they get that constant growth is controlled. Now, what can happen if they don't wear their teeth down enough, and particularly the incisors, but we see it in the molars as well, is they start to overgrow and then they come out of alignment and then just keep on growing. And so we end up with teeth getting very, very long. It stops the rabbit from grooming. The teeth themselves can cause quite bad damage to the inside of the mouth. And once they're out of alignment, they're out of alignment for life. So you end up having to either clip them regularly, and we recommend doing that with a high-speed dental bird, not with clippers, because you cut them with clippers and you can shut it down into the roots, which is painful. Or in some cases, we actually end up having to remove the teeth completely, and that can be quite a good solution to rabbits that are having regular problems, because once they're having problems, they're quite often in with us every month or so to have the teeth bared. So that's really the important message that I want to get out about rabbits' diets is very high energy food is not good for rabbits. Really, grass is what they should be eating, and grass and hay, which it really is just grass in another format, should make up at least 90% of their diet. So really that's all they actually need, because they're these high in gut fermenters. What we're doing, like I say, is we're feeding the bacteria, not the rabbit. And so anything that's high in fibre is going to feed these bacteria well. The bacteria are going to produce all the nutrients the rabbit needs. So you don't actually need these pellets or these high energy foods to feed a rabbit well. You just need that grass. And that, like I say, that grass is going to look after their teeth. It's going to look after their intestinal tract, and it's going to keep them a good weight. It's going to help prevent that obesity. Now, like I say, grass has to be at least 90% of their diet. If you do want to give little extra bits, you can give a tiny bit of pellets, and I'd say certainly no more than a dessert spoon of pellets a day, or you can give them a little bit of carrot or or something that's kind of really kind of rough, fibrous sort of vegetables. Avoid your watery vegetables, so avoid your lettuce and those sort of things. Really, you want those really fibrous sort of veggies that are going to kind of give that fibre and really look after their gut. But like I say, that's less than 10% of their diet is that. Now, the other thing about rabbit care that I wanted to just touch on briefly is vaccinations. And vaccinations in rabbits in Australia is a little bit different to what's available overseas, in that we can't vaccinate against myxomatosis in Australia. Now, the reason for that is because it's a live vaccine, and the live vaccine would theoretically be able to escape into the environment and keep on vaccinating wild rabbits, and that would make myxomatosis less effective. So that's why you can't do it in Australia. It's a shame for pet rabbits, but at the end of the day, we have to look at the greater picture with it, and it is a legal requirement that we don't vaccinate against MIXI. It's not available in Australia, and it's illegal to even import the vaccine into Australia. We do recommend vaccinating against calicivirus or viral hemorrhagic disease, and that's spread by small insects, so your mosquitoes and your fleas and things like that. And when rabbits are particularly prone to this once they reach adulthood, so very, very young, they're not actually prone to developing illness from those viruses. So we recommend starting their vaccination at around 10 to 12 weeks of age. It's just a single injection initially, and then every 12 months we give them a booster. The vaccine's very good at creating an immune response. So unlike cats or dogs where we have to give them a couple of injections at least to start things, we can get away with a single dose for rabbits. Now, rabbits, just the same as dogs and cats, we recommend annual health checks, and things that we particularly look at for rabbits is their teeth, their gut and body condition. Other thing we do actually get with teeth, and I forgot to mention earlier, is teeth when they overgrow, we can start to get some tooth root problems, and that can start to press on the little duct that drains tears from the eye into the nostrils, so what's called the nasolacrimal duct. And once that happens, we can get a condition called dacryocystitis, where the rabbit will get a white muck in its eye and what looks like a pretty chronic conjunctivitis. Once again, once this problem's started, it's very, very difficult for us to manage without actually removing teeth. But removing teeth from a rabbit is pretty difficult because they've got very small mouths, big roots, and because the teeth are constantly growing, you have to remove top and bottom lining, and it's just a very, very difficult thing for us to do. So much better off to prevent problems with good diet. So take-home messages from today: rabbit food, grass, and more grass. Hay is the same category as grass, so we put that all in together. That's all they need. But if you do want to give them something extra, up to 10% of their diet can be pellets or fibrous vegetables. Also, vaccinations we should be doing from 10 to 12 weeks of age, and then every year after that, and that's tied in with an annual health check. If you notice the rabbit is unwell, it's an emergency basically. Don't wait until the next day or kind of give it a couple of days to see how it's going to go. With rabbits, once they're unwell, get very sick very, very quickly, and we need to deal with these things promptly. So if your rabbit's ever unwell, call us straight away and we can give some advice. Generally, it's going to need checking and fairly rapid treatment. That's all we're going to be doing for now for these live question and answer sessions. The format from here on in is going to be probably twice a week. We'll try to do a podcast or a webcast sort of video, and what we'll be doing is talking about a different aspect of caring for animals. So we're going to over time build up quite a comprehensive library of information, so it's going to take quite a while to build it up. If you've got any questions though, please feel free to contact us. If you email eatonvet@eatonvets.com.au, or you can contact us on our Facebook page, and we'll cover any questions you have during those webcasts, and we'll talk to you then. Thanks, bye.